Good evening. Welcome and thank you for joining the Fund Office for the Mid-Career Journeymen webinar. My name is Pete Tonya and I am the Executive Director of Your Benefit Funds. This is our mid-career seminar where we want to review your benefits in a summary fashion to make you aware of the benefit entitlements you are earning as a union carpenter. We would like to have had this seminar in person, but we too are adapting to the current economic and social environment, but we are overjoyed in the response we received and the number of you that chose to join us in this remote version of the seminar. In fact, we're actually hoping to have more frequent remote seminars in the future in light of the overwhelming response and feedback that you have provided. A recent survey by Polygenius uncovered major gaps in Americans' understanding of basic health insurance terms. The survey stated that only 4% of Americans are able to correctly define all four terms that determine how much they would personally have to pay for medical services and drugs that they receive under their health insurance plans. So copays, co-insurance, deductibles, out-of-pocket maximums, these are all common medical insurance terms, but do you know what they mean? So here at the Fund Office, we also understand that after a hard day's work, the last thing you want to do is read our communications. So we are hoping that these seminars will provide you a better way of us delivering the message that we want to share to you. Our goal tonight is to provide you a basic understanding of who the benefit funds are, what we do for you, and describe your access to not only your medical benefits, but also your retirement benefits. Our agenda tonight is pretty simple. We will review with you your medical and retirement benefits. Firstly on the panel with me tonight is Joe Oberhowitz, and Joe is the Philadelphia Funds Office Fund Director, who will review with you a number of slides on retirement benefits. And also Mike Wagner, the medical manager of the fund, and he will describe your medical and insurance benefits, and at the end we will also have an open forum for questions and answers. So before I turn it over to Mike, just a couple quick slides on important resources that are available to you. The first is the fund's website and mobile app. On both of these mediums, you also have access to your member dashboard, where you can see your personal profile and benefits that you have earned. We also send out a monthly newsletter. Our focus here is to provide you with only relevant news and changes without inundating you with boring fund information. And I encourage you to take a few minutes each month when you receive the newsletter to review it. Like I said, we only put important information in it that is relevant to that month or if there are any changes to your benefits. And lastly, the fund has a Facebook and Instagram following. Again, we only post important changes and reminders. The next screenshot is one of your member dashboard of the fund's website. Here you can see that you have your profile with your address, work history, and eligibility. And in the menu, you can also check your annuity count and other important items like your beneficiary, your hours. Here it's important to make sure that the contractor you're working for is paying your benefits. And electronic forms like change of address and reciprocal forms. And lastly, here is a snapshot of the monthly newsletter and our social media. As you may have seen in one of the previous newsletters, we also post member stories. So if you've had a long career or are working on an interesting job that you would like to share with your fellow carpenters, please contact us and we will work with you to draft the article. So thank you for allowing me to introduce the seminar. I will now turn it over to Mike.
Thank you, Pete. Good evening, everyone. My name is Mike Wagner. I'm the medical manager here at the Philadelphia Fund Office. I want to say thank you for joining our webinar tonight. We're excited that you're here. We're excited that you're excited about your benefits. The benefits we're going to go over tonight, it's our healthcare coverage. I want to touch on COBRA coverage because it's important to the May benefit period. I really want to spend some time on preventative care. It's very, very important. You're in your mid-career, probably coming up on middle age. It's important to get the right things done at the right time and know what you're entitled to. And then lastly, we'll go through our HRA and our vacation funds. Make sure you know how those two work and how they interact. Before we get started on our benefits, a quick recap of how you become eligible for those benefits. Hopefully this is familiar ground for you. We just started our May benefit period. There's a corresponding work period to both. Our benefit periods are May 1st and November 1st of every year. The May 1st benefit period, the corresponding work period, 600 hours, and that's a crucial term. 600 hours in 6 months. Always remember that, always be working toward that. The work period from May, August 1st through January 31st. If you don't meet the 600, the fund office automatically looks for 1,200 in a 12-month. The Board of Trustees are receptive to the fact that there's ebbs and flows in our industry. Might be more hours in the summertime than there are in the winter if we get a bad snowstorm. So we always look for 606 or 1,200 in 12 months. The 12-month requirement for May, February 1st through January 1st of every year. The November benefit period, that's an important one right now because we're about halfway through the working period for the 600 hours. The working period for November is February 1st through July 31st. Like I said, about halfway through. How do you know if you have those 600 already? Pete mentioned our member dashboard on carpenters.fund. Log in. It shows you exactly where your hours are. It shows you the hours that have been reported, and it'll show if you're eligible for the next benefit period. Get in the habit of logging in. We send out work record cards. Make sure you're checking that. Make sure your hours are here. Make sure you're getting credit for when you're working, and know where you're at on that 600 toward the 6 months. Again, if you miss the 600, we're going to do a 1,200 look back. For November, that's August 1st through July 31st of every year. I mentioned COBRA, an important impact for this May benefit period. Unfortunately, a side effect of the COVID virus, the COVID shutdowns. We saw a lot of guys miss hours. As a result, because people were losing eligibility for May, between the federal government and the American Rescue Plan Act and the Board of Trustees, they agreed to subsidize COBRA coverage at 100%, so no money out of your pocket if you miss the May benefit period. The American Rescue Plan is going to carry it from May 1st through the end of September. That's how long the government agreed to subsidize. Because our benefit period runs until the end of October, the trustees came in and subsidized that additional month, the 1 month the government isn't subsidizing. This is important if you did not have the hours for May. You should have gotten a letter at the end of March. You would have gotten another letter at the end of April. And by now, one email at least should have gone out to let you know that part of the requirement for getting that subsidy, the coverage was automatic. We didn't terminate anybody on May 1st, so your Independence card didn't get interrupted. Your Express Scripts card didn't get interrupted. But in order to maintain it, we do need an election form back from anyone that was losing May 1st coverage. The election form is available at carpenters.fund. It's due back no later than June 30th. That's very important. The 60-day time frame is set by the government. We don't get any wiggle room on that. So if you have those letters sitting on your kitchen table, you haven't filled out an election form yet, go on carpenters.fund when this webinar is over. It doesn't even take a minute. You and any eligible family members you had on file will maintain your coverage through at least the end of October. The other form I want to make sure that you're aware of, it's our annual enrollment or coordination of benefits. Internally, we call that the COB. On the job site, you may have heard of it referred to as that form that puts my vacation check on hold. It's our annual enrollment. It lets us know if you had any new kids, if you have new insurance, if your spouse is working, if you made any census changes, if you happen to move and need an address change. You'll see a date on the screen. It's April 1st. That's the deadline every year. Goes out in the mail in February, due back by April 1st. If you have not done it, what that means is you're late. Next week, third week of May, we're going to get our vacation payments. If that's not back to me, your vacation payment will be on hold. Again, when this webinar is over, if you're unsure, log into carpenters.fund, click on the COB link. If you filled it out, it'll tell you so. If you haven't, it doesn't even take 5 minutes. All the information is pre-populated. If nothing has changed, you can get right through it. That's a very important term, if nothing has changed. A lot of people think if nothing changed from last year, they don't have to fill out a COB. I need one back every year. So make sure that you're filling that out. Make sure that you're aware of that April 1st deadline every year. So that's how you qualify for benefits. What are those benefits that you're qualifying for? Hopefully this is familiar ground to most people. Our benefits are split into 4 categories. It's our major medical insurance. That's independence administrators. Our behavioral health coverage, things like counselors and inpatient rehab, that goes through a company called Mental Health Consultants. Our prescriptions through Express Scripts. And then our in-house benefits or our fund administered benefits, that's the ones that we process at the fund office. I'll get into what those are in a moment. The 90-10 Coinsurance Plan, we lump independence administrators and mental health consultants into a group. They share a 10% coinsurance. They share an out-of-pocket max. That's $2,000 for an individual, $4,000 for a family. You do access those benefits different. So for your doctors and hospitals, you're using independent administrators. Use their card, use their website to find a provider. If you need counseling, marital counseling, inpatient substance abuse, that doesn't go through independents, it goes through mental health consultants. Their number's on our website. If you require that, make sure you know how to access that. But they do share the 10% and the $2,000. To understand what those two terms mean, we have a video that explains it. It lives on our website. It's out on our YouTube channel. If you're not sure of how these function, make sure you rewatch it, make sure you understand how this impacts you, and I'll let the video explain that to you.
Do you know how your health insurance works? The Independence Administrator's Personal Choice 90/10 Coinsurance Plan provides you and your family an extensive network of hospitals, doctors, and specialists. What is coinsurance? Coinsurance is the percentage you are required to pay after your health plan pays. A 90/10 coinsurance means that the total cost of an in-network hospital visit or doctor's visit is split, with 90% of the bill being covered by the Carpenter's Fund and 10% coming out of pocket from the participant. Within 30 days, you'll receive a bill from the provider with your 10% coinsurance and an EOB from Independence Administrators explaining the payment. A referral is never required to seek the care you need. Verify any in-network provider by visiting myibxtpabenefits.com. Or for more information about your benefits, visit carpenters.fund.
So hopefully that video explained what the 10% coinsurance and the out-of-pocket max means. Again, if it's something that you're unfamiliar with, log into carpenters.fund, check out the video on YouTube, and make sure you understand how that works. Our prescription plan hasn't changed in a while. It's still through Express Scripts. There are some subtle changes that the May newsletter announced. I'm going to get in that in the next slide. But just the general overview is really split into two different kinds of drugs in three categories. It's your generic medications. They carry a $5 or $10 copay. And then your brand drugs. And the brands are split into two different categories. It's preferred brand and non-preferred brand medications. Preferred brand, the way you want to think about it is basically like Coke and Pepsi. There's two competitors in the same area. Express Scripts is going to pit them against each other and see who comes back with the best price. The one that wins out is going to be the preferred. If you're on a preferred brand, you pay a 25% coinsurance, but there is a max you can pay. So for a 30-day, it's $75. For a 90-day, it's $150. For the non-preferred, the one that didn't win out, unfortunately, there is no max, and the coinsurance is a lot higher. It's going to be 40%. So if the drug costs $1,000, you would pay $400 if there's no max. What I try to tell people is if you get to the pharmacy and the drug costs anything other than $5 or $10, or max $75, $150, call the fund office. Don't just pay that out of pocket. Call the fund office. A lot of times it could be something simple that we can help navigate. If it's just a simple error on the pharmacy side, we can get it corrected for you. Or if you're on a non-preferred, we can look up what those preferred alternatives are, and you can let your doctor know that you need to switch over to one of those. So again, if you're not paying $5 or $10, $75 or $150, make sure that you're calling the fund office and making sure what your options are. The changes that are going to come up for July 1st, they were announced in May for the newsletter. The changes for July 1st, typically under the generic slide, I would have been able to say it's $5 or $10 copays, but we waive it if you go to Rite Aid. Unfortunately, our contract with Rite Aid, we weren't able to get that back. So as of July 1st, we won't be able to offer that free generic at Rite Aid any longer. So if you're getting a generic, no matter where you go, it's going to be $5 for a 30-day, $10 for a 90-day. One advantage that came along for July 1st, if you're on what's called a maintenance medication, a maintenance med is anything you fill more than 3 times. If you were on a maintenance med in the past, as of the 4th fill, you had to go to Express Scripts mail order. It's a convenience, but a lot of people didn't really like that option. They would rather just walk into a storefront. If you have package thieves that pick up your Amazon boxes in your neighborhood, a lot of times the drugs went with it. With the postal delays from COVID, we saw a lot of people's drugs getting held up. As of July 1st, you can now use Express Scripts mail order or fill at any CVS pharmacy. The important thing is if you hit the 4th fill, if it's a true maintenance medication, those are your 2 options. Express Scripts mail order for the convenience or CVS if you want to walk into a storefront. If you fill after the fourth fill in 90-day supply anywhere else, you would pay 100% of the drug for not utilizing one of those two. Again, if it's not 5 or 10, 75 or 150, call the fund office before you pay it out. It might just be as simple as your doctor switching from Rite Aid to CVS for that drug, and make sure that it gets covered for you. Those are our benefits that our vendors handle: independent administrators, mental health consultants, and Express Scripts. What our in-house benefits are fund administered. You should be familiar with these. These haven't changed in quite some time. Dental and orthodontia, or your braces benefit. Our vision benefit. Our ambulance benefit. If you take an ambulance ride, the claim should come right to 1811 Spring Garden. And durable medical equipment, or DME. Those are things like walking boots, knee braces. A lot of times we'll see those billed to independents, so if you get a bill in the mail and it wasn't paid by independents, usually it will say carved out to the fund. Send that into the fund office, make sure that we can help you out with that. I'm not going to go into what each one of those benefits are. Again, if you want to know more about your dental allowances, if you're unsure of how the ambulance benefit works, log into carpenters.fund, make sure that you know how they might impact you. With all of our benefits, we're always taking meetings. We're always looking for ways to help you avoid the 10% coinsurance or any of the copays. I want to make sure you know what those vendors are. A new one, and one that really caught fire as a result of COVID, is MD Live. It's called Telehealth Benefits. It's an app essentially that helps you avoid going to either the emergency room or the urgent care. It's a big benefit if you have children at home. Especially with COVID, you don't want to take them into an urgent care around other sick people. Download MD Live. It waives the 10% coinsurance, so you're not going to pay what's typically about $100 at an ER, or between $20 and $30 if you go to an urgent care. That's going to be waived. It's free for you. Log in, use your independence numbers, make sure that you know about that one. Progress Physical Therapy. The nature of our industry is knees go bad, rotator cuffs go bad, you might need physical therapy. You get 30 visits a year. One of the primary reasons we saw people not continuing with their care was that 10% coinsurance, even though it's not that much, can add up when you're on your 30th visit. Progress came along, they said, look, we'll waive the 10%, come to Progress Physical Therapy. We haven't had any complaints from any of our members about it. Go through the care, make sure you know that one's available to you if that's a need. Healthcare Solutions, they do our outpatient radiology at 100%. We've had them forever. Call the fund office, get their number, go to carpenters.fund, get their number, and make sure that you waive that 10%. LabCorp is still covering our blood work at 100%. The major difference here, we used to be able to use LabCorp and Quest, either or. If your doctor asks where your insurance prefers your blood be sent, it's always LabCorp now. Quest, unfortunately, is out of network. So either LabCorp to get paid at 100%, or the doctor can do it in their office. In that case, you pay the 10% coinsurance. We have the 2 scans through Temple. I'll get into what those are in the later slides for preventative care. And then a new one that we want to make sure you're aware of. Hopefully, if you saw this webinar announced in May's newsletter, you also saw the pages dedicated to OneDrop. If you're a diabetic, we understand that the test strips, the lancets, the meters, they add up in a hurry. OneDrop will pay for all of that at no cost to you. You have to register with OneDrop, though. That's important. This isn't an election. If you're a diabetic, in order to get supplies covered, join OneDrop. It comes with an app that has a health coach. It's a major benefit for you, not only in dealing with the chronic disease, but in also not having to pay that out of pocket. So make sure you check back on those pages if this is something you're battling. Know how to access that benefit. Very similar to OneDrop, we're coming up on our 1-year anniversary. Last July, we brought on MD Anderson. Cancer is a major problem in America as a whole. For whatever reason, the prevalence of cancer in the construction industry is higher than the national average. I mentioned the 10%. The video did the $2,000 out of pocket. If you're battling cancer, unfortunately, because it's such an expensive disease, that 10% is going to bring you right to that $2,000. There's no avoiding it unless you go to MD Anderson. The board coupled with MD Anderson last July, they will waive the 10% coinsurance if you have your treatment there right over in Camden. We picked them not only for them waiving this, but also they were the highest ranked customer satisfaction in our area. So we were excited to bring them on. We toured the facility. It's a very nice facility. If this is something you end up dealing with in the future, make sure you know this is out there. Make sure you avoid that $2,000. The other fund administered benefit that I want to make sure you're aware of, we understand that this isn't a very popular one on the job site, so I want to make sure you know it's out there just in case. It's our weekly disability and workers' compensation benefits. Broken into two different benefits, mainly for the reason that weekly disability is if you're hurt off the job, workers' comp obviously if you're on the job. For the weekly disability, since it was off the job, it's not something that happened while you're employed, you're not going to get the work comp, you won't get a paycheck. So in that case, the fund office basically becomes your employer. We're going to send a $550 paycheck out. That is pre-tax. The government does come take a small portion of that. The big thing here is not just the monetary. It's that with these two benefits, we credit 30 hours a week to your health and welfare and your pension. So I mentioned 606, you need to be accruing those hours. The fund will actually put those 30 in. Joe's going to explain to you that you need 800 hours for your pension. Again, 30 hours goes in for that. If you're hurt on the job, your supplemental work comp, so your employer's going to put you on work comp, they're going to send you a paycheck. That's why the monetary value here is smaller. It's $100 for 15 weeks. It's meant to supplement that first couple of checks you're getting from work comp to make sure you make it through. The important thing is, even though they're cutting you a paycheck, they're not obligated, since you're not on the job, to put in hours. So again, with this benefit, you get 30 hours a week toward health and welfare, you get 30 towards your pension plan. I can't stress it enough. If you're hurt, even if you're not sure if it's going to keep you out, call the fund office. You have to report an illness within 30 days in order to be eligible for this. So make sure you're calling. And very important, don't listen to Joe on the job site that tells you that it's better to be on unemployment. We hear that a lot. Unfortunately, it's about 6 months too late for us to help out. People get on unemployment instead of getting on disability. Sometimes it does pay more. The problem is it's not crediting those 30 hours a week. They're not required to. All too often, people don't find out that they've made a mistake until that May 1st date or November 1st when they're no longer eligible for benefits. So again, if you're hurt, even if you're not sure, call the medical department, make sure that we have it documented. We can walk you through what those benefits are. That was a very quick wrap up of our very rich benefit plan. There's a lot to know, there's a lot to cover. I'd probably be up here for 6 hours if I tried to do the whole thing. If there was anything I flew by in a rush that's important to you, again, make sure you're going to carpenters.fund, make sure you're watching our videos, you know how those benefits work. If you have any questions about a benefit that I did not mention, call the fund office and make sure we can explain it to you. The next piece, and I'm going to spend some time on this one, is our preventative health benefit. The mantra of the fund office for the past 3 years, we've been really harping on preventative care. Be proactive instead of reactive. It's a story we hear all too often. People don't actually know their benefits. They don't go see their doctor. They don't seek treatment until they're sick. We want to encourage you, especially being mid-career, being middle-aged, start doing the opposite of that. Use the preventative care benefits that we have available to you. They're covered at 100%. And of course, we're going to start on the uncomfortable topic first. It's your colorectal screening and your prostate screening for men. Men starting at age 40, you're entitled to these two. Again, it's paid at 100%. Make sure that you're talking to your doctor and make sure that you know when you're eligible for this and that you're getting these done. For women, slightly different. You're going to get your mammogram starting at age 40. You're going to get your cervical care test starting at age 21. And again, the colorectal screening. Make sure you know when you're eligible. Because we have so few people taking care of their preventative care, unfortunately, we see a lot of gaps in care in these. There are major screenings to help either predict or prevent cancer in the future. I do want to give you stats. I mentioned that cancer, unfortunately, in the construction industry, more prevalent than the national average. One of the ways that you help combat that is, number one, getting your regular preventative visits. Number two, getting your screenings on time. We don't get enough screenings done, and I get it. They're uncomfortable. No one feels like doing them. But the stats around cancer, I'm going to focus on colorectal. 1 in 6 men in their lifetime could get colorectal cancer. That means if we have 300 people on the webinar tonight that say that all of them are men, that would mean that 50 people out of those 300 are going to battle colorectal cancer in their lifetime. Using the screenings, if it's caught in its early stages, the survival rate is higher than 90%. More than 90% survive if it's caught in the early stages. Unfortunately, if you delay, and we hear it too often with our disability benefit, with our retirement benefit, we hear it too often that guys don't find out they have colorectal until it's considered stage 4, very late. The survival rates drop from 90% to less than 20. So 9 out of 10 are surviving if it's caught early. Less than 20% are surviving if it's caught late. Make sure that they're finding it early. To help with that, the fund office is coupled with a company called ColoFit. Instead of going in for your colonoscopy every 5 years, dealing with that, go on our website. It's completely free. Get a kit mailed to your house. You don't pay for it. It's very simple. You mail it back and you're good to go. So I mentioned 2 ways to find cancer early. Make sure if you're one of those 1 in 6, that you're one of those 90% that survive it. It's the early screenings, and most importantly, getting your preventative care visit once a year. We have 2 ways to access that. The fund office comprehensive physical, which brings up patient first. It's a new benefit for us. Not a new benefit, a new vendor as of February 1st. You can go through the fund's comprehensive physical or your independence administrator's wellness visit once a year. What it is, the comprehensive physical, your wellness visit, your doctor's going to do the basics. Height, weight, they might do blood work, they might do your vitals. Our fund comprehensive has always done more than that. They do a complete blood panel, they do an EKG, which is important for your heart health. We recognize that we used to have 12 vendors. Unfortunately, they weren't heavily utilized. We'd only get about 200 people to take part in that a year. The reason being, and we get it, if you miss a day on the job site, you might be at risk of losing your job. You're definitely not getting paid, and you don't get that 8 hours towards your health and welfare and your pension. To help with that, Patient First came along. They're open 365 days a year. They're open until 10 o'clock at night. If you don't have a primary care physician, they can become your primary care physician. Most importantly, it only takes about an hour and a half to 2 hours to get all the work done. Know where you stand from an overall health perspective. Know if you have anything that you need to get addressed. There's no reason to not go. You don't need an authorization number. You don't need permission from the fund. If you're passing a patient first and you got an hour and a half, walk in, they can knock out the physical right then and there. The other 2 screenings that I want to make sure that you're aware of, it's our temple heart scan and our temple lung scan. Patient First and our temple screenings, really all of our benefits are the same. For a member, we always mention the members because that's who we're used to dealing with. But really we should say participant. The members and their spouses are covered for these benefits. Now there is an age difference. Men starting at age 40, women starting at age 50. That's set by the medical guidelines. They're guidelines, they're not deadlines. So if you're a woman, you're age 43, you're not eligible for the heart scan, but you have a family history of heart attacks and strokes, call the fund office, we can definitely get you in there. These are no cost, and between our Patient First physical and just a couple of months we've had so far, and our 2 years running now with heart scan and lung scan, we've had more success stories of people finding out they had underlying conditions that they would never have known about. We had one person using our heart scan. They thought that they were otherwise just a regular healthy person. They ended up having, I think it was an 8 bypass, the most that you could get, and it was as a result of the temple heart scan finding that for them and saving their life. Take advantage of these. Go as a husband and wife if you have to. Get your physical, get your heart scan, get your lung scan, make sure that you know what you're up against. With that, so Temple brought those 2. Temple also trains what are our fund nurse team. We have 2 nurses on staff. They work for the fund office, trained by Temple Health. They're here as an advocate for you as the member. If you go to Patient First, if you come up as a risk on the heart and lung scan, we have Nurse Fran that sits in our office 5 days a week. You may already have gotten a call from her depending on what your scenario is. Again, she's here as an advocate for you to make sure that you know the outcome of any test that you got, to make sure that you know the benefits and how to best navigate them, to know if one of our free benefit options is available to you. So Fran sits in the office. She'll take inbound calls if you have questions. She makes outbound calls. We also have Nurse Nicole, who's a traveling nurse. If you're inpatient in a hospital or you're recently diagnosed with a chronic disease, you may get a call from Nurse Nicole asking if she can come visit you. Again, to make sure you know your benefits, to make sure you know what's available to you. Accept that call, accept the invite. They're here as an advocate for you. They know the questions to ask for your doctor if you're on a new medication. If they're requiring surgery, whether or not it might be a good idea to get a second opinion. Accept their help. They don't report back to your employer. They don't report to the board. They're simply here as a tool for you to use. Please know they exist, and if you have any questions, please reach out to them. That's our full benefits again. I sort of flew by. If you have questions, there's a preventative health page on carpenters.fund that can walk you through those screenings. If you have questions about what you might be entitled to, or again, you have a family history and are worried about whether you can get in for a scan early, call the fund office, call Nurse Fran, they can walk you right through that. Our health reimbursement account, these are the last two benefits I'm going to go over. It's our HRA and our vacation benefit. They changed about 3 years ago. We just want to make sure you know how those changes might impact you. It used to be one benefit, our vacation benefit. You get the manila envelope, you'd be saving your receipts all year. You'd mail in a giant envelope, sometimes of legitimate receipts, sometimes of newspapers or toilet paper. You don't have to do that anymore. That was the unreimbursed medical piece of the vacation benefit. The HRA replaced that. And I'm going to let a video explain to you how the HRA works and what you're entitled to.
The Carpenter's HRA is a valuable benefit that helps pay for health-related out-of-pocket expenses. In the complex world of healthcare, it is important to keep your expenses in check. But that's easier said than done. If they could be managed conveniently with a single solution, things would be simpler. Now they can be. The Carpenter's Hra Payment Card is a way for you to use your tax-free HRA contributions to pay for qualified healthcare expenses, such as prescriptions, co-payments, coinsurance, and eligible over-the-counter items, right at the point of sale, as well as the amount due on medical statements you receive in the mail. When you use the payment card, the cost of your eligible expenses will be automatically deducted from your account, so you won't have to routinely submit receipts to verify the purchase. Just swipe and go. It's that easy. In addition to your HRA payment card, you will have access to a secure, easy-to-use web portal and mobile app to track your account balance, view claims, and submit requests for reimbursements for any non-card transactions. When you are ready to file a claim, simply log in, select HRA account, and upload your receipts. You can even take a picture and upload them right from your phone's camera. And if you need help, asking a question is as easy as clicking a button. For more information about your HRA benefit, please visit carpenters.fund.
So same as the 9010, that HRA video lives on carpenters.fund. It'll be out on our YouTube channel. If you need a refresher on how it works, please log in and watch it. We're constantly trying to find ways to get more videos out there, so please check back in. Make sure you know how the benefits work. Just as a quick reminder, the video mentioned 2 ways to access the benefits. It's the Blue MasterCard or the web portal. The reason I bring this slide up is that there is a subtle difference. The Blue MasterCard does not work for your dental and your vision benefits. It doesn't work for the ambulance or insurance benefits, but the 2 big ones are dental and vision. And the reason that is that we want to make sure the money that's in the HRA, that's your money. It's meant to pay for the 10% coinsurance if you run into that. It's meant to pay for things that the fund doesn't pay for unreimbursed medical-wise. We don't want you to go into a dentist that could accept the fund's dental allowance, where the fund is actually making the payment, hand them the MasterCard, and the dentist just says, look, I'm sliding this because I can get paid today. Let them bill the fund office. Make sure if we can make a payment, you're utilizing the fund's money before you utilize your money in that HRA account. That's why those 2 are different. So just understand that if the card doesn't work at either one of those 2, that's the reason why. The other things we want to bring to light, just because we do get these questions at the fund office, the HRA account does not work for groceries. Even though you might be trying to qualify lettuce and broccoli as a health reimbursement account, it doesn't work. No gas stations. It doesn't work on toiletries. It obviously won't work at a restaurant. And the number one confusion when we first rolled this out, and it's not a joke, it does not give cash back out of an ATM. Some people are confused about that difference between the HRA MasterCard and the portal. It's not that you put in a receipt on the portal and the money goes onto the Blue MasterCard like a prepaid MasterCard. Just 2 different ways to access that benefit. So no, it will not give cash back out. Again, if you're confused about the HRA or if you need a refresher, please reference back to that video on our website. The HRA covers the unreimbursed medical piece of the old vacation plan. The vacation benefit still exists. It's the other half of the contribution, and it's split into two things, vacation and dependent care. The vacation payment, if you're just happy getting it, you don't have to turn in receipts any longer. It comes out 4 times a year. February, we have one coming out in the month of May, August, and November. They come out automatically. The only reason it wouldn't is if you elected a tax-free benefit, and that's independent care. If you have kids 12 and under, you're paying for them to go to daycare, summer camp, where you pay someone to come over and watch them. You can claim that as a tax-free benefit. So you avoid the taxes that would come out on the vacation side. In that case, it does convert. A form comes out every December. Turn it back in if you have kids under 12 and avoid the taxes. But from there, because it's tax-free, you do have to submit receipts to claim that money. You submit it to our Collections and Hours department. There's a link right on carpenters.fund. Submit the receipts, make sure the money comes back out to you. And the way that happens for both, for the HRA, for the vacation, whether it's vacation or dependent care, is via direct deposit. We don't cut checks anymore. If you get a reimbursement from the fund for vision, it comes out in the form of a check, but these come out as direct deposit only. So next week when our vacation payment goes out, it will be in the form of a direct deposit to your bank. There are 2 ways if you haven't gotten a vacation check in quite some time, because of that direct deposit. It's either that you have not turned in your COB. So if you haven't gotten one, please call into the collections department. Find out if a COB is on file. If it's not, let's get that corrected so that you can catch back up. Or if your COB has been in on time, but we didn't have direct deposit information for you, it may be that money's been flowing over into a union building trades account. If we don't have a direct deposit, the money still goes out quarterly automatically. It will go into a union building trade. So again, if you haven't seen that coming out, please call our collections department, find out where it's going, and if it is going to the union building trades, their contact information is here. When we send this webinar out to you in email, you'll get this slide to let you know to give them a call, or find their information on carpenters.fund. That's our medical benefits in a nutshell. Like I said at the start, it's really just a touch on the basics of it so you understand what's out there and what's entitled to you. There's a lot of nuances, a lot of subtleties to our benefits, a lot of carve-outs to try to make sure you're getting the best benefits possible. If I went too quickly past one tonight, if you have questions in the future, the best resource, as Pete mentioned at the start, is log into carpenters.fund, find the page that's applicable to you, make sure you understand it. As always, if you do have questions that the website isn't answering, please call the medical department of the fund office. We're happy to help walk you through it, answer any questions that you have. Or use the chat feature on our website, and same thing, you're getting a live medical representative from the fund office, so we can help walk you through that as well. And with that, I'm going to turn it over to Joe to talk about the pension benefits.
Thank you, Mike. My name is Joe Obahowitz. I'm the fund director here at the Carpenters Benefit Funds of Philadelphia, and I'm going to give you an overview of your retirement accounts, notably your pension account, your annuity account, and your savings account. We want to make sure you're going to retire with dignity and security. We always like to show this slide, and these are the average numbers of a carpenter that works between 25 to 30 years of service. You can expect at retirement an average annuity account balance of approximately $300,000, an average savings and account balance of over $80,000, and a monthly pension of approximately $6,000, and that includes the supplemental benefit, also known as the double bubble. And typically, if you have between 25 and 30 years of service, you would retire with healthcare coverage. Retiree healthcare coverage. Now, how do you qualify? We have 2 different classes for retiree healthcare coverage. We have a Class 1 coverage and we have a Class 2 coverage. Class 1 coverage, you would qualify is if you have 30 years of credited pension years and 60 consecutive benefit periods. Under the Class 2 coverage, you need 25 credited pension years and at least 50 consecutive benefit periods in the health plan. The best thing is that the coverage between Class 1 and Class 2 is the same exact coverage as an active carpenter. However, the difference comes in between Class 1 and Class 2 coverage in the form of a monthly copayment at retirement. Class 1 coverage has a lower monthly copayment than the Class 2 coverage because you worked more time. Now, what is the word consecutive? The word consecutive means uninterrupted years of credited service in the pension plan with no breaks in service. However, if there is a break in service, the missed years of credited service must be made up before retirement. Under the health and welfare plan, uninterrupted health and welfare benefit periods would be considered a break if you did not have health and welfare eligibility. However, again, if there is a break in coverage, the missed health and welfare benefit periods must be made up before your retirement date. I'm going to show you an example of a break in service and how that break in service was made up on the next slide. As I mentioned, this is an example of a health and welfare benefit period with breaks in service and how those breaks in service were made up. As you can see, the participant missed 2 benefit periods from May of 97 through April of 1998. However, this participant made up those 2 benefit periods by earning eligibility in May of 98 through April of 99. So the rule of thumb is that your amount of time out has to equal your amount of time back in before your retirement, and we would consider that consecutive service. The same would apply for the pension plan. Your pension plan is considered a defined benefit plan and is paid out to you on a monthly basis after you retire. The contribution is included in the fringe benefit package from your employer. The calculation is based upon a yearly accrual that is set by the Board of the Trustees and the credited service you earn while working. The pension plan year starts every May 1st and ends every April 30th. Now, vesting and credited service. Now, how do you become vested in your retirement accounts? Now, since we're in the mid-career seminar, I would assume that everyone in here would have more than 3 years of credited service. However, if you do not, in order to qualify for your retirement accounts and become vested, and when I use the word vested, you may have heard that before in the past, that means that you have a non-forfeitable right to your benefits. And in order to qualify for vesting, you need to have 3 years of credited service in the pension, the annuity, and the savings plan. And again, all of the plan years start on May 1st and end on April 30th. Now, how do you become vested and how do you earn credited service? I'll explain in the next slide. Now, how do you earn credited service? As I mentioned, under your retirement accounts, the plan years start every May 1st and end every April 30th. So if you work less than 200 hours in a plan year, you do not earn any credited service. If you work between 200 and 399 hours, you would earn 1/4 of years of credited service. Between 400 and 599 hours, you would earn half a year credit. Between 600 and 799 hours, you would earn 3/4 of a year credit. And if you work 800 or more hours, you earn 1 year of credited service. In order to qualify for any of the fractions of a credit, you have to have at least 1 good year of 800 or more hours. Now, here's an example of how the credited service works when it comes to your pension statement. So if we look at the plan year, May 1st, 2017 through April 30th, 2018, this participant worked 1,400 hours. Therefore, they qualified for 1 year of credited service. The following year, May 1st, 2018 through April 30th, 2019, this participant worked 1,500 hours. Again, another year of credited service. And if we look at May 1st of 2019 through April 30th, 2020, this participant worked 1,700 hours, again, earning another year of credited service. So during this time period, this participant would have had 3 years of credited service, which would have qualified them for vesting. An example, if you only had 600 hours, you would have only have earned 3/4 of a year of credit service. And again, that would have been reflected on your pension statement. Now, here's an example of the pension statement. The pension statement, you can request once per year. They are not automatically mailed out to you, so you do have to contact the retirement department and request one. Most members contact us around their birth date and request a pension statement. I'm another year older. I'm another year closer to retirement. Let me see how far I got and how much credited service I have. It's going to list your pension plan years. It's going to show your credited service, and it's going to show your accrual that you earned during that time period and what your projected monthly pension would be at your retirement. Now, how do you get there? How do you get to that early retirement? Well, we use what's called the Rule of 85. The Rule of 85 consists of an age requirement and your credited years of service. The earliest you can retire under our plan is the age of 52 years old. In order to retire at 52, you got to have 33 years of credited service. You can also retire at 53 with 32 years of service, 54 with 31 years of service. You can retire at 55 with 30 years of service. And you can also retire at the age of 62 with 10 years of service. If you meet those qualifications, you can retire early with full accrued benefits. However, if you don't meet that rule of 85, you can retire at the age of 55 years old, but if you have less than 30 years of service, your pension will take a reduction. The supplemental benefit eligibility, also known as the double bubble, as most of you probably know it out in the field. How do you qualify for the supplemental benefit? Well, if you have 30 years of credit service, again, you would qualify for the supplemental benefit. And it would not be reduced for early retirement because you met that rule of 85. If you have between 25 and 29 years of service, you would also qualify for the supplemental benefit. However, because you don't have 30 years of service, it would get reduced. If you have under 25 years of service, you may be still eligible for supplemental benefit, but it would get tiered. And I would suggest you contact the benefit funds at the time of your retirement to find out if you do qualify for the supplemental benefit. Unfortunately, if you have less than 10 years of service, there is no supplemental benefit. Some important information about the supplement benefit and when it will stop. The supplemental benefit, also the double bubble, will stop following the retiree's 62nd birthday. It'll also stop if you return to current employment and work over the allowed 40 hours a month, absent a waiver by the Board of Trustees. If you're granted a Social Security disability award, you do not collect your supplemental benefit. Also, it'll stop if you perpetrate any type of fraud upon the fund and when you pass away. Some other pension features we want to touch upon is we do offer a disability retirement. In order to qualify for a disability retirement through your pension, one, you have to be an active participant when you apply for the disability pension. You have to have at least 10 years of credited service before the disability. You have to have a Social Security award that was awarded to you on or after May 1st of 2019. And also you have to be deemed to be unable to be gainfully employed in any occupation. Also, some other important information I want to talk about is your change of beneficiary. Make sure, if you haven't done so recently, make sure we have the most up-to-date beneficiary information on you at the fund office. God forbid something happens, we want to make sure that your earned benefits get into the right hands. Also, reciprocal hours and reciprocal forms. We're a big union now. The Eastern Atlantic States Regional Council's jurisdiction is very big. However, the fund offices are still regionalized. So if you work outside of the Philadelphia jurisdiction, make sure you contact our fund office and fill out a reciprocal form. The reciprocal form allows us to go retrieve any hours that were worked out of our jurisdiction. And also, an unfortunate topic is divorce. If you did go through a divorce or in the middle of a divorce, you need to send us a copy of your divorce decree and your property settlement agreement. Active participant death benefits. Now, these are pre-retirement death benefits. Under the health and welfare plan, your spouse or your named beneficiary would receive $25,000 if the death is of natural causes. If it's an accidental death, your spousal beneficiary would receive $35,000. Also, your spouse or eligible family members would receive health care until the end of the current benefit period, plus an additional 12 months. As far as your retirement accounts go, under your pension, your spouse would receive half of your accrued pension for the lifetime with a 10-year guarantee. An example of that is if your pension was worth $3,000 a month, your spouse would receive $1,500 a month for their lifetime. If there's no spouse, a lump sum would be paid out to the named beneficiary under the pension. As far as your annuity and your savings accounts, they would get paid out in a lump sum or a rollover to your spouse or your beneficiary. The annuity plan. The annuity plan is considered a hybrid defined benefit plan. The annuity contribution is included in the fringe benefit package as a set dollar amount that gets allocated to your account for each hour you work. The account is credited with an interest rate based upon the average of the 30-year Treasury rate in the month of March before the plan year starts. At your retirement, you'll have three options in order to have your annuity account paid out. You can have it as a monthly payment, as a cash out or as a lump sum rollover. All vested participants receive their annuity account statement in August. If you have not received the statement, please contact the retirement department and we can look into it for you. As you know, the annuity account is broken into two accounts. Account A is for contributions before May 1st of 2018, and account B is for contributions received after May 1st of 2018. Both accounts are calculated the same way using the Treasury rate. The only difference is account B has an interest rate cap of 6%, where account A has no cap on the interest rate. The combination of account A and the combination of account B is your total annuity account balance. The savings account is considered a defined contribution account. The savings is included in the fringe benefit package as a set dollar amount that gets allocated to your account for each hour you work. The account is considered a participant-directed investment account, meaning that you have control over where the money can be invested. The Newport Group is the day-to-day record keeper of the savings account. They just transitioned to a new website with a new phone number to access your information. The information is listed on the slide. You can also find it on our website anytime at carpenters.fund. As I mentioned, the savings plan is a participant-directed investment account. You have a total of 15 investment options to build your portfolio. It's a mix of stable value funds, bond funds, large cap, mid cap, and small cap funds. If you're savvy enough to do your own research and build your portfolio accordingly to diversify your investments, my hat's off to you. If you're not, and you're overwhelmed because this is not what you do, that's okay too. This is why you'll see the bolded default funds. These are the accounts that are set it and forget it. Your money auto defaults to one of these accounts based on your date of birth and adjust accordingly as you get closer to retirement to be more conservative with your investments. Again, you can do your own research at the Newport Group's website. At the time of your retirement, you're going to have two options as far as having your savings plan paid out. You can lump sum cash it out. Unfortunately, there are tax consequences that come with that. Or you can have a direct rollover to your own financial institution. Another feature under the savings plan is a hardship withdrawal. There are certain guidelines and requirements to qualify for the hardship withdrawal. One is you have to be vested in the plan. You also have to have a balance of at least $2,000. The limit of the amount you can take out is 50% of your balance up to $50,000. You're only allowed to have one hardship withdrawal every 3 years. And you also must meet one of the following 5 criteria. It's to purchase your primary residence, to save your primary residence from foreclosure or eviction, to pay outstanding medical bills, for funeral expenses for you or one of your dependents, or for post-educational expenses for a participant or, again, for one of your eligible dependents. If you need a hardship, please contact the fund office. In closing and recap, we talked about the important resources and the communications tools that are available to you. We talked about the COBRA and the eligibility for that. If you qualify for the COBRA coverage, make sure you fill out the required information in a timely manner. We talked about benefit coverage, preventative health, the Temple health screenings, and the Temple nurse program. Also, we talked about the HRA and how you can use that to your advantage for any out-of-pocket expenses. We also gave you an overview of the retirement accounts, notably the pension, the annuity, and the savings. And as always, if you ever have any questions, please contact the fund office. And also, please fill out the survey at the end. It helps us plan for future seminars.